See, all these post-modal cells I am removing in the end after having opened the sphenoid sinus. So in any given situation, I don't go behind that. See this? My sphenoid is so deep. See this?
Yes, sir.
But my limit, trying myself to keep anterior to this ostium. I don't go there. That's the point I wanted to make. Because if it is onodi, there it is going to be the optic nerve. See this? All flushed anteriorly, all post-modal cell, that is all lamina.
Sir,
No cell there.
laterally and inferiorly, the sphenoid sinus, can it be widened still more?
That's
Or
what
is
I'm
it,
doing now. See this?
yeah, carry some sponge, yes.
You can use sphenoid punch, you can use drill, you can use debrider, you can use any instrument.
Yes. Do you advise wide sphenoidotomy?
Yes. See, the aim is to introduce your topicals later on. See this?
Yes, sir.
I don't recommend widening inferiorly, otherwise you can damage the vessel. If you want to further widen, through it. I can widen with a punch anteriorly. See this?
Yes.
I can widen it anteriorly here safely. Rather than widening inferiorly to damage the septal branch. Okay?
Okay, okay, sir.
That was the party wall between this and the onodi cell.
Yes.
So this is all about the sinus surgery in this particular patient. This is a classical example of CCAD. See this? The medial part, only thing the turbinates were disease, having concha, laminar cell, they themselves was harboring the disease and unstable, so they had to be removed. There is no way out, And this is what about the limited septoplasty we did. See the excess on this side. Earlier, there was no excess at all, if you remember.
Yes, sir.
Okay. Thank you. Now, the last case of the day is coming. It's a bilateral FESS. Probably I'll show one side so that we can, finish before 7. The other side we are not going to demonstrate. And that's again any questions?
So would you consider this to be a type 2A frontal sinus draft opening of the frontal sinus?
Pardon?
The opening that we have seen over here that you have made in the frontal sinus.
Yeah.
That is basically a draft 2A.
Yes, a lot of people call it draft 2A. Lot of people call it draft 1. Draft 1 is excentrating all cells to the level of the ostium.
Okay, sir.
In regular sinus surgery, you are not supposed to go to the level of the ostium. Just widen the cells below that, below the frontal sinus ostium, not to the level of the ostium.
Means
when you widen to the level of the ostium, it is draft 1. Some people call it draft 2A, and once you remove the anterior wall, they call it draft 2B. Some people call draft 2A removal of the anterior wall till the middle turbinate medially, and draft 2B till the septum. So like different terminologies. Why to fall into controversial terminology? So you can call it whatever.
Right, sir. Right, sir. Thank you, sir.
Any questions before moving to the next one? Hello.
Hello, sir.
Hello.
Hello, sir.
Yes.
Sometimes like patients, they come on their own. Like if we write some medicines, like they will not come back. So what to do in that case?
I didn't get your question. Please, can you repeat?
Like sometimes the patient comes, like we need you told me surgery 3 months back, like that. In that stage, like maybe she was having some mucopus in the sinus, middle meatus. Can we operate?
Yeah. So what was done earlier? It all
No, no,
depends
no.
upon.
No, surgery was indicated previously, and she came back after 3 months when the symptoms were more. Like, can we do directly surgery, or do you advise to give her antibiotic and do surgery?
See, you have to assess whether medical treatment is not curative. See, every patient is different. So if you find the entire profile indicating medical treatment is not going to work, better, operate. But you have to prepare for that.
Sir, one more question. Sir, in the second case, whenever you are packing the nose, do you give pack in the middle meter, sir?
Yes,
In both
for
sides?
2 days.
For 2 days. Okay.
Yes.
And along inferior tablet, the other one, I mean, 2 packs on
Yeah,
each side, like that,
Yeah,
sir?
2 packs, two long packs on each side,
Okay.
and rest small in the cavity.
Okay. And all the packs are removed after 2 days, I mean, 48 hours, right, sir?
Roughly.
Roughly. Right, sir.
Which pack you prefer, sir, to avoid adhesions, sir?
Using simply Merocel, nothing else. See, adhesions will form
Sir,
if you don't correct the turbinate and septum. When your
so-
opposing surfaces are close by, then only adhesions can happen.
Sir, do you use any antibiotic or steroid solution to moist the Merocel, or just
Yes, steroid soak Merocel.
And sir, what is the steroid concentration you use to soak the Merocel, sir? Just
Dexona,
simple Dexona. Neat.
most economical. Yes.
Okay.
So do
Thank you,
use
sir.
paraffin around the Merocel to prevent pain
Yeah.
while removal or something?
You can use that just before removal,
Not during packing.
not during. Because you are operating under general anesthesia. While you remove, you can start, soaking in paraffin half an hour before.
Okay. Thank you.
So what was the intraoperative BP and pulse in the last case?
Same normotensive, pulse around 60. I saw 57. Kitna tha? Yeah, 57, 60. Lower pulse is most important to reduce the cardiac output.
I think dextromid was used. No?
Pardon?
I think dextromid was used.
Dexmed.
Yeah.
I don't know. Our anesthetists try different combination, but they use sevoflurane, they use probably midazolam and some beta blocker. A lot of people use clonidine, a lot of people use beta blocker. There are many ways to. Dexmedetomine is one of the way. Many things. That is anesthetist domain. What we want is a pulse around 60, whatever way they bring.
Sir, there are some dissolvable packs which need not be removed. Do you have any experience with that?
Merogel. Merogel
Merogel.
packs are available, but
Is it?
Merogel induces a lot of fibrosis.
Okay.
So it has been, disregarded now. And a lot of people who were using earlier have given up.
Okay. Thank you.
Now, regarding the last case, we have to finish it anyhow before 7, the demonstration part. So I'll show you on one side quickly. We have seen most of the things, in both the cases. 3